Oh, the birds and the bees. When conversations arise about that, well, conversations and perhaps questions arise about contraception too. Joining us now from Women's Care Florida is Dr. Ryan Brosch to give us the latest about this age-old conversation. Welcome to the show. How are you?
Thank you, Natalie. It's great to be here. Thank you.
Let's shed some light, because I feel like it has been an age-old conversation. Things are always changing. Sometimes there's myths, sometimes there's rumors. What's out there these days as far as contraception goes?
Sure. So when I talk to my patients, I'm always talking about three different big branches of contraception. First being the most common that people think about, which are barrier protection methods. Those are condoms, essentially, both male and female condoms, and they provide both birth control and also protection against sexually transmitted infections like gonorrhea, chlamydia, and herpes. The second arm that I talk about is the ones that are short-acting and are hormone-based, and the two big branches of that arm is going to be the estrogen and progesterone methods, the pills, the patches, the NuvaRing, and the progesterone-only methods, which are going to be the mini pill, Micronor, and the Depo-Vera as well, which is an injection that you get every 3 months. The third arm of that conversation is talking about the long-acting reversible contraceptives, and the two big branches of that arm are going to be the implantable device that goes underneath the skin called the Nexplanon, gives you a little bit of progesterone every day to prevent you from ovulation and also prevent you from getting pregnant. And the second arm of that larger category being intrauterine devices, or IUDs, and that's a combination of the ones with or without hormones. The ones without hormones being the Paragard, which is a copper containing IUD that goes inside the uterus and can stay in for up to 10 years and protect you against pregnancy. And then the other ones being the progesterone-only the progesterone-only containing IUDs, the Micronor, the Kylena, and the Skyla. And those essentially can go inside the uterus and stay between 3 and 5 years, depending on the type.
Man, I can tell this is not your first day on the job. You just rattle through those, and it's just an example of how you talk with your patients, though.
Absolutely.
How important is education when it does come to contraception? Because it is a big choice, and I think there are a lot of factors for each woman, right? Or man.
Absolutely, 100%. Education and patient education is one of my primary focuses when I'm talking to my own patients. I want to make sure that women are empowered to make choices that can affect their life. I want to make sure that if they want to have a baby, I can be there to help them through that. And if they don't want to have a baby, I'm definitely there to help them prevent that.
You know, when you were saying some of the latter forms of birth control that we see, like the IUDs and the implants and things, you do sometimes hear some negative backlash out there, like, oh, you know, so-and-so had a problem with this that I heard about from my mom's mom, you know, those kind of things. Let's talk about safety and how important safety is when you're educating and making that decision on which birth control is right for you.
Absolutely. Every birth control has some of its own drawbacks, some of its own risks. The hormonal ones, the ones that containing estrogen, you can have increased risk for blood clots or increased risk for heart attack and stroke in certain patients. Patients that smoke over the age of 35, we're not recommending them ever get put on estrogen because they already have increased risk for those particular things. And then the implantable devices, especially the intrauterine devices, the IUDs, a lot of patients worry about the horror stories they hear from their friends, like maybe their patients or maybe their friends were in a lot of pain afterwards or had a lot of cramping, or the rare stories that you can hear from the devices actually being embedded inside the uterus or inside the muscle of the uterus, or potentially even getting poked through the uterus and then the IUD getting put inside the belly instead of in the right spot inside the uterus. But the fact of the matter is, when you look at the statistics on those sort of rare complications, it's extremely uncommon. We're talking about 1 in 1,000 patients that would experience a rare complication like that.
And of course, I know you, again, back to the education for all of your patients. What do you see in the most these days in your office when it comes to, say, questions or conversations that people are wanting to know right now about contraception?
The biggest thing that I'm continuously asking in clinic is, like, what is the best one? What is the best one that will prevent me from getting pregnant or help me with my cycles? And unfortunately, there's no best one. Each method has its own drawbacks, its own benefits, and it has to be a personal choice and a conversation between you and your gynecologist about what is the right method for you. Because depending on your medical history of your other medical problems and what you want out of your birth control, there's a variety of things, but there may be one that is best for you that wouldn't be best for the woman in the room next to you.
Well, again, thanks for being here. I think this has been an age-old conversation. It's always evolving. So I do appreciate your time coming in, chatting with us today. If you have questions on anything we discussed or anything that falls under the women's care field, well, of course, your Women's Care Florida, they can take care of you. There's the website you see on your screen. And again, Dr.